Happy New Year. It's 2026.
Happy New Year, Jan, and happy us to another year of Energy Diagnostics podcast.
Right. And all our viewers out there, welcome back. I know it's been a minute, but as much as you had holidays, we did too. And traveling and seeing family and eating food and trying to get back to the gym. But we've got another show ready for you here on Energy Diagnostics
We do.
Podcast with who do we got?
Dr. Daniel Yadegar was back. He's in the house. He is the new Dr. Oz. He is an encyclopedia of knowledge where he bridges, of course, he's a well-known cardiologist, but with natural health. He even has a supplement line, Dan. To finally, there's a doctor, a physician in the world that figured out nutritionally what is necessary for hair growth. And he also schooled us about being very conscientious to not overtake biotin, which was kind of the go-to for a couple of decades, right?
Mhm.
And he's gotten wonderful results. Listen, Vogue, Bride Magazine, New York Times, Page Six, Dr. Daniel Yadegar, my friends, we are so happy that he is back and he has honored us by being on Energy Diagnostics Podcast. Stay tuned because you don't want to miss this episode.
This is a new year, new podcast. Friends coming back in. It's 2026. It's freezing here. I'm sure it's much warmer where both of you are. We're single digits today, but wonderful to be here. This certainly warms me up to be in company with both of you again today on this fabulous new year, kicking this off with, once again, Dr. Daniel Yadegar coming back. He's gonna bring us some more knowledge.
Unbelievable. Like we didn't get enough. Like we're so greedy. I love us on Energy Diagnostic Podcast. We're so greedy, okay, because we couldn't get enough. I've been having conversations, even dinner conversations with colleagues, Dr. Dan, talking about your episodes like, wow. And I said, he created that the morning of when you invited questions from viewers. And he just whips out, right, Dan? This intricate PowerPoint with all
Yep.
the bullet points with the answers to our viewers' questions. This blew people away. We couldn't not start Energy Diagnostics Podcast without inviting you, Dr. Dan. You are the voice of many, and you have a unique something. Can I give you a little feedback from the peeps in the field that I talked to?
Please, I'd love to get feedback.
First of all, welcome. Happy New Year to you and the family. Thank you for all you do. Thank you for returning. We're very blessed.
Thank you so much, Joy. I think you know, and I'll probably say this on every episode, you're one of my favorite people on the planet Earth. So any opportunity to spend time with you is something that I'm eager to get on the calendar and do. So the honor is really all mine.
Oh my gosh. Are you going to make me cry already?
That's because you know it's true.
Well, it's mutual, and I really love what you bring. Here's the consensus from our time together, back-to-back episodes with Dr. Dan, right? He is on the cutting edge of letting us know what's coming for us, right? With medical science, new techniques, new tests, new everything. And we're going to tell our viewers about how they can benefit from you on the daily. You don't want to miss this, folks. But I work with a lot of people in the field, as you know. And over the holidays and things, Dr. Dan, people were gobsmacked and amazed because these are people, some are from the medical, but they're also in holistic health. And they're like, we've never met a doctor, heard a doctor speak who has this knowledge of medical science, right, at the top level, but also understands holistically, nutritionally. That was a big blow away for people. They love that reel about you talking about how many classes or units you actually get around nutrition in medical science. And they were so happy because they felt like there was someone who's in medical science who is a bridge between both the allopathic as well as understanding an alternative path to treat the whole person. That was the big blowaway. That was the big takeaway. Now, I know that about you because I've been blessed and honored to know you these years, but to hear this from the pros that have been in the field for decades about the importance of your message just made my heart sing. I wanted to share that with you. Dan, if our viewers are just meeting Dr. Dan, give them a little background about our friend here.
Yeah, I got a short little bit here. We can talk about Dr. Dan. If this is your first time, you're so lucky because you're going to watch this episode and then you have 2 more to go back and catch up on. And so it's a win-win. We have Dr. Dan Yadegar. Dr. Dan, a triple board certified specialist in internal medicine, cardiology, and integrative medicine, trained at Harvard and Cornell. And you apply a functional medicine approach to hair health. Here we are on the Wellbel site, focusing on the whole person rather than just symptoms. Recognizing that hair often reflects when nutrients and hormones need support, you created a safe, effective solution to restore hair health. And the result is physician-formulated products that nourish your hair, protect your health, and restore your confidence. And I really liked looking over this, that you're treating the hair, but you're treating dysfunction within the system, not just a Band-Aid approach to things.
Yeah. So, the interesting thing is that Wellbel was born out of my sister's having postpartum hair loss. And one of my other sisters was going through a difficult time in her life and she had hair loss. And I looked at the supplements that were out in the market and I wasn't really happy with what was available. So, just as sort of a side, sort of fun experiment, I created the Wellbel formulation on paper, really. I had no intention of creating this into an actual business. And I contacted a manufacturer that's very, very reputable, that has third-party testing and does really good supplements in New Jersey. And I said, hey, can you guys put this together and just send it to me? And they sent it to me in these unmarked white, sort of like science experiment bottles. And, my sister trusted me and they took it and I forgot. I mean, I knew I gave it to them, but I forgot. And this was, right before the pandemic, and we were in Tribeca in New York City grabbing some sushi, and my sisters were like, "Dan, you don't understand. My hair is completely different. I have all these baby hairs coming out." And I said, "Oh my goodness." I said, "Do you have any side effects?" "No." And the issue with some of the other supplements out there is that they have too much biotin, and biotin is very important for the body, but as with anything, if you have an excess of biotin, you could end up with biotin overload. The symptoms of biotin overload include breaking out, cystic acne, abdominal pain, nausea. Thought it Biotin looks a whole lot like vitamin B5, which is synthetic acid. So if you take enough biotin, your body gets confused and doesn't absorb enough of the B5, and some of the side effects that you get are from that sort of competition and not getting enough B5 in your body. And in addition to that, biotin interferes with some really important lab assays. So thyroid lab assays, and as a cardiologist, it actually interferes with the troponin assay, which is the gold standard of how we diagnose heart attacks. So if you're taking enough biotin, you can come in with a troponin level of 0 while you're having a heart attack and fool the cardiologist into thinking that nothing's going on. So there's a very big part of me that's like, you know what? I need to create a formulation that's good enough for my family members, that's safe from, assay standpoint, thyroid assays, troponin assays, and that thinks more holistically and has a high yield, high impact group of ingredients that many people can take to help improve their scalp health and hair health. So that's where Wellbel was born. And then, the pandemic happened and, me and my sisters just, started putting the business together and helping people and getting on Zooms. And it grew out of necessity and out of a desire for people to have something more innovative and thoughtful.
Well, Dan and I have made a decision. If it's okay with you, we want to take your supplements and we're going to do an experiment with, who doesn't need that,
I will get both of your addresses and I'll send you the supplements. And so right now we have 3 SKUs, but we're continuing to build. Right now we have the main SKU which is Wellbel Women's.
Mm-hmm.
And I know that the hormonal needs of women who are perimenopausal and postmenopausal are different. So I did some minor tweaks, and we have Women's Plus,
Mm-hmm.
women or 45 and older, and then we have a men's line. So we'll get you those supplements for sure.
We
Oh,
can't wait
we can't wait.
to report the results, right? I want to be out like here, like I want an 80s style.
Uh, you need a lot of hairspray.
Aquanet, gotta get some Aquanet. So
Yeah.
so interesting with the you said you tweaked it I'm sorry, the women for the perimenopausal. So does that also help treat some, I know there can be some scalp conditions like some scalp psoriasis with any hormonal changes with women. Does it address some of that, or is that kind of a different thing altogether?
It does. I mean, I think hair health has a lot to do with scalp health, and we have an ingredient in there called MSM. MSM is a natural anti-inflammatory found in a lot of vegetables and a lot of the foods that we eat. MSM is directly anti-inflammatory at the scalp level and at the level of the follicle. So, although we don't make any claims against that, taking a supplement with MSM can really help with overall scalp health.
Interesting.
Here, we just give him a reflection from colleagues out in the field that are so impressed with his ability to write. Here's a top cardiologist, and he's just listing a full of the ingredients and this incredible formulas to make perfect sense with what we know, Dr. Dan. So thank you so much for that. I also want to say, I wanted to comment because I enjoyed watching your programs from last year. And I was really touched by the fact that you're a family guy. You really are. Like the fact that you wanted to help your sisters, with what was distressing them, and to research that and use your knowledge as a physician to say, there's got to be formulas. And then you're out and they're saying, hey, it's working. This is coming back. I've always wondered why someone wasn't working internally for hair growth. And it seems that you were truly capturing, the attention of many. Dan, let's name it. Page 6, Dr. Daniel Yadegar was written up on. New York Times, right? Goop with Gwyneth Paltrow. Vogue, Shape, Brides Magazine. Dr. Dan, you've gotten, and this is just a few of the amazing write-ups and feedback and promotion and people wanting to share with their readers and their viewers, your great supplement line. So congratulations. And if folks, you want to go to Wellbel, WELLBEL.com to check out what we're discussing here, that really is cutting edge and works for hair loss. So thank you for that. And we want to talk about something else, if you don't mind. Your Instagram, Dr. Dan. Folks, watch our previous episodes with Dr. Daniel Yadegar. We talk about how broken the medical system is. We know that in many ways. And here is this world-class physician feeding it up on the daily, ladies and gentlemen, with amazing information. Dr. Dan Yadegar, you have to get this on Instagram. He is doing reels, educating the world all the time. I just posted one yesterday. I got lots of great feedback on. I got to tell you, in my mind, as a healer, as a counselor, right? And as a facilitator, I've been curious about long-term effects of GLPs.
That's an amazing topic. It's such a good topic, and it has so many nuances to it. And I know the world has sort of been taken over by these GLP-1 receptor agonists. These drugs have been around for about 2 decades. Initially, they were approved for the treatment of diabetes, and then they realized that for people who do have obesity and cardiometabolic disease, so prediabetes, high triglycerides, and who are at risk for cardiovascular disease, that giving them these GLP-1s could be really miraculous. It could help, curtail their appetite, and get them to lose the weight. And, so much of disease comes from obesity. Obesity can create inflammation, it can create sleep apnea, diabetes, heart disease. It actually increases your risk of cancers as well. because when you're obese, you can develop insulin resistance and you can become estrogenic, like, have your testosterone convert more to estrogens, and that can
Mm.
feed certain cancers like breast cancer. So, it was such a huge breakthrough, these GLP-1 receptor agonists. But then what happened was that they started being used off label, not in the study cohort that was studied originally where the approval came. And that's where some of the reluctance about the GLP-1s came about. The number one being that if you're on a GLP-1 receptor agonist, there is a risk for muscle loss. And muscle loss is real. Muscle is gold when it comes to longevity.
Yep.
Muscle is gold when it comes to dictating your basal metabolic rate. And as we get older, our muscle mass volume goes down and our basal metabolic rate goes down. So if you're someone who's trying to lose 4 or 5 pounds and you go on a GLP and you lose weight, up to 40% of the weight that you lose can be muscle mass. And regaining that muscle mass later on in life can be very difficult. So I always try to educate people, if you're going to go on a GLP, do it in a really thoughtful way. I really think it works best for people who really meet the primary inclusion criteria used when the studies occurred. And then if you are going to use it, really say to yourself, okay, I'm going to go on a GLP, but I am going to get to the gym, work on the big muscle groups, the hamstrings, the quadriceps, the glutes, do your squats, your deadlifts,
Mhm.
and increase your protein intake. Obviously, do it in a way that you're not going to get injured, but at least go into it knowing that you really have to think about your overall muscle mass. And as we age, maintaining muscle mass is very important. So it is a double-edged sword. And me as a physician, when I prescribe it, I really have to have a certain calculation of who is the patient. If it's an elderly, frail patient, maybe a GLP-1 is really not the best,
Right.
treatment for them, because I don't want to accelerate or hasten frailty. I don't want to create a more frail patient and have them lose muscle because we're trying to lose weight. And maybe we look at some of the basics in terms of diet and exercise, as ways of doing it in a more, sort of healthy, quote unquote, natural way. I think
Hmm.
so. The bottom line is I think there's a role for the GLP-1s. I think it's a massive advancement in medicine, but it has to be done thoughtfully in the right patient with the right perspective. And the interesting thing, Joy, is that when Wellbel was launched, one of our big selling points was that there was a lot of COVID-related hair loss, and it seemed like Wellbel was helping with that. Now that COVID is not so much of a thing, we are seeing a lot of GLP-1 receptor-related hair loss, and there's sort of this influx of people who have hair thinning as a result of being on the GLP-1. So Wellbel can help support that kind of hair loss as well, and we see a whole lot of that in the clinic.
Interesting.
I love how this weaves together.
It does. Yeah, I was jumping from thought to thought, but
It's all integrated. It's
Now,
amazing.
is there, I don't know how the GLP-1s are prescribed, but is there a way, is it possible to maybe give a lower dose? I don't know, like a lesser dose, and like you said, tailor it with that educational piece. Like, listen, you're not going to get that wow factor of losing a ton of weight in 3 months. It might take you a year, but it's going to be safer, and we're going to work on your habits. So hopefully, when you get off the GLP-1, you'll have these better habits in place, so that way you can still continue on your lifestyle and maintain more of that muscle mass. Is that
yeah, I
something?
think that's a really good point. I love the idea. When it comes to medicine, more doesn't always mean better. So when we treat heart disease and someone has a lot of plaque, the greatest benefit that comes with a statin, whether it's Lipitor or Crestor, is in the initial dose. When you double the dose of Crestor or Lipitor, you're only decreasing cholesterol by additional 6%, while you're incurring more side effects. Same thing with GLPs. If we can get them on the lowest dose of the GLP-1s and sort of encourage them to work on the lifestyle stuff, a lot of the muscle loss indeed is related to the actual dose. So the higher the dose is, the more sarcopenia, muscle loss that you experience. So I sort of love that there's creative solutions. You have to work with your clinician. Again, I think GLP-1s are really amazing. There's evidence that it could be good for heart disease and neurodegenerative disease and prevent Alzheimer's and help with insulin resistance, especially in the right person, but not everyone is the right person. And I think that there needs to be sort of, I believe in this N of one medicine, that every person is different and that we're entering this generation of like precision medicine. So, Dan, you and I are different, me and Joy are different, and what our bodies need in terms of support, nutrition, alimentation, medications is going to look different because our lifestyles are different, our genetic blueprints are different, and we're starting to enter an age where we're starting to look at people from that standpoint of the precision medicine. Everything from, there's this really cool thing called polygenic risk scoring. Have you guys heard of this?
No.
I don't think I have.
The really big word, polygenic risk scoring. Say that 3 times fast. But basically, we have a way at scanning your DNA and saying, okay, we look at heart disease, colon cancer, pancreatic cancer, you're genetically higher risk for this particular thing. I'll give you an example. I did a polygenic risk score on a patient, and he placed at the 99th percentile for prostate cancer. Doesn't mean that he's definitely going to develop prostate cancer, but his risk compared to the average population is higher. So I thought to myself, I got to treat him differently than the person whose PRS is normal. So what did I do? Every 6 months, we measure his PSA level, and every 2 years, we get an MRI of his prostate, and he's in his 40s. So I'm going to catch that prostate cancer before it's manifest. And the reason I was able to do this is we're taking advantage of genetic information and this sort of precision N of one medicine to make informed decisions. And I think we're going to be seeing more and more of that.
That's I know I don't know if we talked about that specific test last time, but we did talk about different cancer treatments and gene therapies where it really can be if you can get a blueprint of somebody and then tailor it to a dose of the GLP-1 or different peptides. I know peptides are really coming up and becoming used more from instead of human growth hormone and different things like that. But if we can have tests where we can, like you said, like we can really detail it in to make sure we're treating the person as that singular person and not just kind of blanket throwing medications out there that may not be necessary, or it could be too much, maybe a lesser dose or maybe a higher dose, depending on where they're at and what their genetic makeup is.
I'm excited too that more insurance companies are seeing the benefit. And look how this really works into cardiology, the support of GLP-1, et cetera, and medicines being accepted by insurance companies because they were being sold from places just like salons and things, which is super dangerous if people aren't being, watched through, have follow-up care. And how would they even know this great information that you're sharing that a physician should be having conversations with when these are prescribed? So I feel hopeful that insurance companies now are seeing the value and actually paying for them because I think there's going to be less risk and negative implications and emergencies, because of not having the appropriate dosage, conversations. I loved what you talked about lifestyle, Dr. Dan. Now, you just did a great reel on that. Folks, you want to go to Dr. Dan Yadegar Instagram. Please follow his page. It is a wealth of information, and you go into that people can actually lose up to 40% muscle mass. Now, after we reach 50, we are encouraged, right, to do weight training because it's all important for longevity. The reason I liked this too, in terms of the integration of all that you are and do, Dr. Dan, is you're really about aging, happy aging, living your best life, and really support people. We live longer. And you are into really helping people, work on their aging. Tell us about your passion for that.
Yeah, I mean, it's one of the reasons after I did my cardiology fellowship and then I did my functional medicine fellowship was with the desire to really help the entire person. And as science moves forward, being able to incorporate some of that science, both on the diagnostic side and leverage testing, as well as on the therapeutic side, is fascinating. So I'm really, have my finger on the pulse of what's going on in the laboratory, but that's not the whole story. We also understand that sleep matters, that conventional wisdoms around nutrition and stress management if we're all very honest with each other, the 6 years post-COVID, both because of COVID and a lot of socio-political things, has been a great burden of stress on a lot of people and has resulted in a lot of illness and disease. Some people are alienated. There's a lot of mental health issues, and we know that the mind-body connection is there. So, all these things are, there's sort of like the molecular science, and I think that stuff is super fascinating and interesting. And then there's sort of like the more metaphysical aspects and community aspects and how the world is shifting and the energies out there and things that we can do small things we can do every single day to make our lives better.
Mm.
And that they don't have
Just
to be massive undertakings.
it's one of my favorite takeaways. Folks, you want to watch these episodes from Dr. Dan. You mentioned something. People get overwhelmed when they get a diagnosis. I'm sure that you see this daily or weekly. And it's, oh my gosh, where do I start? I have so much to do. And, you really left a message for the masses, which is it starts with daily choices, moment to moment, good choices that start to lead to better and better health. It was one of the, I would say, greatest ways as a physician to share, don't lose hope. Every day is a new opportunity to make healthier choices. And each healthy choice leads to healthy aging, which is what you're all about, right? And living your best life. And don't get overwhelmed. Take it slow, and really championing the small choices that really lead to better health. So thank you for that.
Absolutely. And that's the thing. Like when you look at overall health, it's little small steps that end up adding up over time. You know, are you focusing on good, healthy sleep? Are you taking those walks and trying to get your steps in? When you're at the supermarket, we all have choices. There's so many choices in the supermarket
Mhm.
about what you put into your shopping basket. There's a million choices. It could be processed, refined foods that are all in boxes, or it could be nutritionally dense vegetables and fruit and lean proteins and fiber and omega 3s. All these things come down to making the best choice. But over time, it adds up and it accumulates, and you can be rewarded for those good decisions. So make good decisions.
Sometimes that's easier than said than done. But no, right, because if we do that and we do make the majority of those good decisions, then when it comes time for a celebration, a birthday, and the holidays, it's not such a setback that we have the piece of cake or the thing. We can still enjoy ourselves with it, knowing that the majority of our day and the majority of our choices are healthy ones for us. Right? We got to have some fun too.
You do. It's funny. So my son goes fencing on Saturdays, and there's this incredible, incredible bakery in Miami called Casa Bake. They make these croissants that sell out by 10 a.m. And you better believe that most of the week I am really good. But when there's that Casa Bake moment, I am stuffing that croissant in my mouth and enjoying it. So it does have to have a certain degree of balance, but the overall thing is make good decisions. Most of your meals are healthy.
I
Stick to
love your honesty with that. That's
right. You got
awesome.
intermittent fasting, except for the croissant on the Saturday, right?
It needs to be a carve out.
And thank you, Dan. You just reminded me there was two other topics that were recent reels. Folks, again, Dr. Dan Yadegar on Instagram. You've got to go get your daily dose. Start talking about this in the office, at lunch with your friends and colleagues. Share this information that is free. He's all about reaching the masses and he wants to touch as many lives as possible. You were talking about creatine, super important, right? And Dan and I had a little discussion about that before, and I have one other topic that you covered too, most recently. Dan, talk about that for a second, and I want to tell you about the aha that Dr. Dan taught me in one reel. Go ahead.
With the creatine, yeah, it's it's not just for bodybuilders anymore. They're finding not only does it help right maintain muscle mass, but they're also seeing some neurological benefits. Yeah, with
Yeah, there's emerging evidence that creatine, in the 3 to 5 grams a day can have benefits for cognitive and brain health. I think all these things are going to end up being related, but there seems to be benefits of creatine both in terms of muscle mass, muscle volume, endurance, recovery, and there may be additional benefits as well.
And you made one statement in this reel: be careful and mindful of creatine if you have any kind of kidney issue. That's super important. Tell us more about that.
That's super important, and I think, like, an important conversation, I really encourage that anyone that's listening to me, when you're thinking about taking supplements, creatine, NAD boosters, whatever it is, I think having an informed conversation with your doctor, or your primary care physician is very important because they have a holistic view of your past medical history, what medications you're on, what things might have interactions, and I think that's always a good idea. So try to check in with your doctor, let them know. But in terms of creatine itself, if you have any underlying kidney disease, you want to be careful about taking it, and make sure to discuss it with your physician.
See what happens? We just can't go to a corner store that sells nutrients. We really need to be informed. And Dr. Dan, we appreciate you having a passion for, as my teacher Barbara Brennan used to say, treating the whole person. You discussed some of the, long-term effects of COVID in terms of loneliness, needing community, physiologically, spiritually, relationally, right, as well as physically. And also just wanting to connect people and realize the need for connection and what can be some of the factors if we don't have that. It's really treating the whole person. I want to hear, before we close today, Dan and I are both wanting to know what you're excited about for the new year. And we'd like you to share, you're so humble, but you have such a big heart yourself. He's a cardiologist, go figure it out. About the reach that you want to have, the impact that you want to have to help humankind.
Thank you, Joy, for that lead in. What am I the most excited about? I mean, the thing that comes to the top of my head, and it's just come up so many times in the last week or so, is regenerative medicine and the ability to take advantage of stem cells to regenerate tissue. There's a certain new kind of stem cell called MUSE cells, MUSE cells, and not all stem cells can differentiate into liver cells and eye cells and heart cells. But these MUSE cells have something called pluripotent potential. So the MUSE cells have a honing mechanism where they know where the site of injury is. And I'll tell you what brought this to the forefront of my mind. I have a friend who was diagnosed with autoimmune hepatitis in adolescence. She was 12 or 13 years old, and she's developed liver cirrhosis now. So she has fibrosis of the liver. This is a woman who is a Harvard Business School graduate, super achiever, amazing heart, IQ and EQ through the roof, who's sort of, dealing with the difficulty of a condition like autoimmune hepatitis, cirrhosis. And I said, I wonder if these MUSE cells can help support your liver. Now, I don't know for sure. There's been no, placebo-controlled trial on autoimmune hepatitis and MUSE cells. But what I'm trying to point out is that there's a lot of hope in terms of the science and technology that's coming out there in terms of helping people with really difficult catastrophic diagnoses. And that makes my heart happy, that makes my brain happy. I can't wait. Things are moving forward at like a quantum speed, meaning that what we're achieving in 1 year now is compared to like, what we would have achieved in 10 years, 20 years ago. So things are just happening at an accelerated pace. And I'm excited to see the role of AI with drug discovery, the role of regenerative medicine and stem cells. I do think that the paradigm is very slowly shifting to diagnosing and treating disease before it's manifest. We can take on the diagnosis of Alzheimer's. And we had a period of time where the US invested tens of billions of dollars in Alzheimer's trials, and all of them failed. And the
Hmm.
reason it failed is because our patient selection was wrong. We were going after patients once they had memory loss. That means that the beta amyloid protein got deposited into their brains, and they were giving treatments to try to help people who already had, sort of moderate to severe Alzheimer's. What we're learning now is that we need to identify people who are at risk for Alzheimer's earlier on, as early as their 30s and 40s, and start intervening from lifestyle, medications, early on. The same thing goes with heart disease. We don't want to wait for someone to need a coronary artery bypass graft or stenting or carotid surgery. We want to sort of really focus on preventative medicine and especially focus on those people who are the highest genetic risk or lifestyle risk of going on to develop disease so that we can intervene and change the trajectory before it becomes clinically manifest. And I think those are things that I feel really excited about and that I want to put my momentum behind. To answer your second question, I'm so humbled by it, Joy.
Mhm.
I mean, I don't know. I always play this like exercise in my head. Like if I'm an old man and I look back, what would I have wanted to accomplish? And, I'm a single dad. I had my kids on my own. That was part of the algorithm, like having children, being a dad. And part of that, like intuition, is I want to help as many people as possible and sort of be the trusted voice around a lot of this science and wellness and
Mhm.
health and longevity information, both to inform people, but also to lift people's worries about aging, disease, misinformation. There's so much health anxiety. And I want to sort of be the antidote to that.
The healing response to health anxiety.
Yeah.
We've got a new byline for Dr. Dan, including healthy aging. And just, I love the fact that Harvard graduate, Cornell graduate, top in the world as cardiac surgeon and in care. And you so want to get your message to everyone. Folks, please share and follow Dr. Dan Yadegar on Instagram, especially if people have health anxiety, if they want to know more about healthy aging, if they want up to the minute things that Dr. Dan is excited about, that he's got his finger on the pulse before any of us would. And certainly, like, I just watched one reel and got that piece about how important it is not to take creatine if you have kidney issues. I had no idea. And more than anything, you really do support everyone to really always be working with their physician, making informed choices, but having these open conversations as well as treating the whole person. So I want to thank you, Dr. Dan, for your passion. And I do love how you named, I like to have this conversation with myself and look back as older man, how do I want to make this world a better place? And it makes me wonder if that's part of your global mission, your world mission. And I want you to know that Dan Zavadil and I are all about getting your message out. We are so proud and happy that you would join us. It's so great to be in your presence again. We want to thank you for helping others, not just people that you see as patients, but really putting yourself out there for the world to share knowledge about really living their best life. And we can feel your heart in so doing. Thank you for joining us on Energy Diagnostics Podcast.
Thank you.
Hey, everybody. Thank you so much for tuning in. Joy and I really appreciate it. Hey, if you're liking our content here, please make sure you like, follow, subscribe on your favorite platform to make sure you, stay up to date with all the latest and greatest we put out here at Energy Diagnostics Podcast.
That's right, Dan. And if you're liking our content, folks, please feel free to share so others may enjoy the benefit of the wisdom our guests are offering.
Thanks so much and be kind to each other out there.